Campaign, the Cuellar and Vanessa's back.
Hey.
Finally, it felt like forever.
Chill out. It was only 2 weeks. Or a week?
I don't know. In this campaign, 1 week feels like a month. So what's been going on since my last pod? So I went to filing frenzy. So technically I couldn't file because I'm running for a federal office. So I actually need to file through the state chair. But we still wanted to be there.
Yeah, support.
Yeah.
It takes a lot to get
people.
Out. Yeah.
Met some really amazing people as always, and invited family. Even though technically I wasn't doing the filing, we still invited family to make it like a cool event.
And then you had a panel.
Right. So I went to a panel at UTRGV. It was a candidate forum. It was interesting because there were 7 of us, I believe. 3 who were running for state representative, 2 who were running for Congress, but not in the same district. And then someone running for Justice of the Peace, and then someone running for Texas State Board of Education. Gave a little speech at the beginning, just a little introduction, and then there were questions, and I didn't know all the answers. So that was a little tough. I do tend to know a lot, but for whatever reason, there were some issues that I didn't know the nitty gritty. But I will say that I'm still willing to show up, unlike Monica de la Cruz, who doesn't show up at town halls.
Right.
So, you know, sometimes I'm not going to know all the answers, but at least I'm willing to be there.
And then
law school is almost done.
Can we cue music? Fireworks. It's almost done.
I mean, kind of, but not, because I still have a final exam coming up.
Yeah.
But I finished my last asynchronous class. I finished my last live class. So I'm almost done.
Oh, that's awesome. Congratulations.
Yeah, it's awesome for you because you don't want me in class.
Well,
it takes up
a lot of time.
Takes up time.
Studying, yeah.
Yeah.
Which I get. Anyway.
So the shutdown's nearly over. Allegedly tonight, it should be close to being over. Yeah, obviously healthcare is not going to improve.
Right. For healthcare, it's like impending doom.
Yeah.
Coming.
People are continuing to struggle and costs are getting even worse. There was apparently a 91-year-old woman who got arrested for stealing because her husband's medications went from $50 to $950. And she saw him struggling to breathe. He has congestive heart failure. And she thought the only solution was to steal medication. And that's how desperate people are getting.
It's only beginning.
What's wrong with this country? We really need to wean ourselves off the insurance companies and the middlemen. And we need to give people a public option. And we need to make everything affordable. That was really interesting because the judge had a lot of grace and said that she wasn't a criminal. This was a failure of the system.
They've been married, her and her husband, for 65 years. So yeah, she said that's all I have. So that's why she decided to steal. And I mean, I can't imagine watching my loved one not being able to breathe.
I mean, are the Republicans going to do anything? They're in power, right? So
across the board,
they need to do something to make healthcare much more affordable and stop worrying about profits and about corporations.
And we can go ahead and segue into they're going to confirm Casey Means to be the Surgeon General.
Well, she hasn't had her hearings yet, but she's almost due for confirmation hearings now that she's had her baby. So I touched upon it a little bit last time. I have had a problem with Casey Means since January. So this was well before there was any mention that she might be part of the administration. Maybe there was very, very vague speculation, but we didn't know at that point that she was going to be nominated for Surgeon General. I think my biggest concern is she doesn't understand the people. I read a lot of her book, and I sensed that she has privilege, which I'm totally fine with. I have no problem with people who have privilege. I just think that they should also understand that other people don't have the same privilege, and things are harder. It's harder to buy expensive ingredients and to have the time to cook. There's just a lot that's harder when you're not privileged. And so it's not necessarily easy.
So overall, you're just concerned that she's not fully aware of the systemic problems.
Right.
And so then how do you, if you've never been in the dirt, how are you going to fix it?
Right. Because it's not just the privilege. It's also the fact that if you look at her career trajectory, I'm not sure that she understands either. She went to an ENT residency. And in her final year, she quit. Allegedly because she was concerned that she wasn't really treating the root cause of disease. And then after that, she transitioned to a functional medicine practice.
Okay.
And I'm not sure if she's licensed right now, but last that we checked, she does not currently hold a medical license.
As a PA, I have a license. And I've worked in the ER and different settings.
Right.
So you kind of understand how the system works.
Yeah. Well, I'm not saying that she doesn't know anything. but I just feel she doesn't know enough. And I think bringing in someone who never really worked in the dirt, like you said, and someone who has a lot of privilege is not going to connect well with the problems that most people have. I mean, most people, like I said, are not going to be able to afford expensive ingredients. It's not easy for a lot of people to make that time to exercise. It's not easy for a lot of people to get a personal trainer or whatever needs to be done. That's the problem I have. Like, I totally agree that people need to eat healthier. They need to exercise. There are a lot of issues that need to be addressed, and medication is not the answer a lot of times. But what's her actual solution other than live this life of privilege like me?
Historically, functional medicine is cash-based because insurance companies do not want to fund it.
Right.
So I wonder, would she push on that?
Well, that's another issue, right? Because if she's not even dealing with insurance companies, she also doesn't understand that aspect.
Correct.
So she doesn't understand what the doctors go through and the patients go through as far as prior authorization and other barriers that occur.
And there are big barriers because as a functional medicine provider, most are cash-based. My team tries to charge the insurance first to see if that will be covered. And I think out of my 600 plus patients, one has been covered. I think one of the biggest issues is that I would want to see if she will be able to move the needle on, will she be able to get functional medicine, another option, covered by insurance?
That may be one of her focuses because I think she is profit driven and she wants to make sure that functional medicine survives.
Well, I think functional medicine will survive because people who can afford it can do it.
Yeah. I mean, I don't have a problem with it. But I just think that she also does have a profit motive. I think the reason that we're here is because of distrust, like we talked about before. People are distrustful of the whole medical community, right? And that's why we're where we are now, where we have RFK in our administration and possibly Casey Means as a Surgeon General. And you pointed out that there are real reasons why people are distrustful.
Yeah, across the board. I think that when, as an emergency room physician, and me when I was in the ER, we don't really see that aspect because we're just here to treat the acute problem, and then you go back to your PCP.
Yeah.
But I know even with my grandma, she was in a system that she was depressed. She told him, "Hey, I'm lonely." She was a widow. Of course, she's going to be lonely. And by the time I had the knowledge to help my grandma, she was on 4 antidepressants. That's unacceptable. So for 2 years, she was sitting in her chair, just always falling asleep during the day. And my family and I didn't know what was going on until I got a hold of her. Went with her to a doctor's appointment. And I was like, this is insane.
Yeah.
So had to take her off slowly. And then thankfully that I have that knowledge because she was able to spend time and go visit her sister the last year of her life.
Okay.
And get out of the chair because she wasn't being medicated.
But tell me more about how she got to 4 antidepressants, because we're not trained to just give a lot of medications.
Not in emergency medicine.
Well, in general, I feel like we've been taught do no harm, less is more.
It's an ACO system.
So what you're saying,
word?
Is it's not related to at the root the doctor. It's related to
the system.
The system.
Yeah, I mean, we have so many doctors and so many mid levels leaving that system.
Okay.
Because they don't agree with it. But how can you also fault some that's
so they're
job?
Trying to meet metrics.
Exactly.
So it's not that we at a root want to prescribe 4 antidepressants. It's that we're being told if you don't meet certain metrics. Then something's going to happen as far as payment, less payment, or something like that.
Right.
Okay.
It's kind of like
so what metric were they meeting? Was it a PHQ or something?
I have no idea. I'm not in that system. But it's kind of like the ICE agents who joined to help people, right? Or to get the criminals out.
Right.
And now they're faced with, you have a metric. They are given, you have to bring in so many people a day. They didn't sign up for that. People who went into medicine signed up to help people, and then they get put into a system, get a job, and then it's like, oh, hey, you have to meet these metrics. And you're like, what the heck?
Yeah. And somehow I always bring this back to my bad online reviews because this is kind of what happens even with the review situation. Do you just go ahead and give the patients a bunch of prescriptions so that you have good reviews? And some doctors have told me, you know what, I'm just going to give them because I don't want the bad reviews.
It's a battle.
Yeah.
Because you have to, you're trying to educate them, but sometimes people think they know more about you because they Googled things.
Yeah.
And that's hard. They don't understand. This is one example. They don't understand antibiotic resistance and,
right.
And
the very specific situation that the patients were upset about, which is via telemedicine, they wanted prescriptions that were not indicated.
You shouldn't do that.
Right.
Because as you say, you take an oath to do no harm.
Right.
But then they write a bad review about you because you don't give them the antibiotic.
And then people are like, she's horrible for Congress because she has bad online reviews. No, these are real stories.
Yeah. Yeah. We can go back and talk about how you want to integrate everybody.
Right.
For example, like when you were at the forum, you were asked a question about farmers, but you've always talked about what do you want to do if you're in Congress?
I need to talk to the farmers to determine what the best solution is.
Yeah, because you're not a farmer. I didn't know you don't have a farm land back there or something behind your house that you farm.
Yeah, that's true.
You're not a farmer.
Right.
So just like you're arguing about Casey Means, she's never worked in the dirt.
But again, like I always go back to, I don't want to say that privileged people can never understand us.
Right.
Or understand non-privileged people. I think it's very possible, but I think it's hard. I think what she's shown me so far is that she doesn't really understand. I don't think that Donald Trump and Monica de la Cruz are showing any indication that they want to understand. I think they're showing an indication of wanting power.
Right.
And wanting to be cool and take photos. Right. But I don't see people that are actually wanting to understand and wanting to help the people. This whole campaign, what we've talked about is how important it is to collaborate with people, talk to people who really know the problems. So my concern with Casey Means would be, is she going to talk to the people? Is she going to talk to the primary care doctors in the Rio Grande Valley and other areas and the mid-levels in order to determine what the issues are so that she can really help us move forward? Because yes, she's Stanford educated. She did most of her ENT residency. She practiced functional medicine. But I don't think she really gets the issues that we're facing at this level in the Rio Grande Valley. And I don't know if her agenda is really more of a profit-driven agenda either. That needs to be sorted out as well if she gets confirmed. For example, I had a patient and a mother who were super frustrated because even though the ER I work in now is very affordable with cash pay prices, it was still a lot. Even $500 was a lot because he was pointing out to me, I only make like $10 an hour. Mm-hmm. So it's still a lot of money to me. And so it's so frustrating. He and the mom, it's so frustrating, they said, because to you, it doesn't seem like a lot of money, but to us it is. And it's so hard to get medical care. He's sick. He's throwing up. He has abdominal pain. He needs a work note. And I'm just so frustrated at everything because you just don't understand how $500 is a lot of money. So that was pretty tough.
Punch in the gut.
Yeah. So if $500 is a lot of money to some, imagine now with the premiums that people are seeing.
Yep.
I mean, people are just not going to be able to afford healthcare at all. So we've talked about this before, that one thing we want to do is create a free clinic, especially if we're not going to have any movement with affordable healthcare. In addition to that, we've talked about also going out to the community and doing some free consultations because of how unaffordable things are and how we want to help people. It's such a broken system. We're just going to have people just give their time and help people out.
Well, I guess that's about it for today. Please go and call at 956-320-9073 if you have any questions or anything you'd like to ask Dr. Cuellar. You can find her on all social media outlets and
drcuellarforcongress.com and donate.
Well, have a good one.
Until next time.